The next part of the program is chiropractic care. Now, has anybody here ever been to a chiropractor for fibromyalgia? Yeah, a number of people. And has those of you who have been, have you found chiropractic care to be effective for fibromyalgia? No, hasn't been effective. Maybe some people have been a little bit effective. Okay. The reason it hasn't been effective is because it's not enough. If you've got these toxins in the system, you've got to get rid of them. However, chiropractic care combined with this program has a great value, and I'm going to show you real quick what that value is. And those of you, a lot of you have heard me talk about this before, but I want to make sure everybody understands this, because this is the combination of care that I think makes a big difference in how quickly this program works. In neurology, there's a term called neuroplasticity. And neuroplasticity means the ability of the nervous system to change itself according to the demands that are put upon it. Now let me give you a great example of neuroplasticity. Has anybody here ever wanted to learn to play the piano? Probably everybody at one time, right? And what is the one thing you know is going to happen if you're going to learn to play the piano? Practice, right? You got to do it a lot. And if you practice, if you commit to it and you do it, don't you get better at playing the piano? Yeah, it's going to happen if you do it. Now I want to show you why that is. It's actually based in neurophysiology. If you have a nerve, except my writing isn't any good. We'll say this is a nerve, and at the end of the nerve is something called a neuron. And here we have another nerve with another neuron. This gap between the nerves is called the nerve synapse. What happens when the nerve fires is a signal goes down the nerve, and at the level of the neuron, chemicals are released. Neurotransmitters, they're called. And these chemicals are released, and they bind with the receptors along this area of the other nerve. They bind. And as they bind, they cause the next nerve to fire. It's pretty simple, right? It's a chemical reaction that occurs at the level of the synapse. Now, here's what happens. Let's say this nerve is a nerve for coordinating your finger movement, and you are learning to play the piano. So this is playing the piano. The more you practice, a very, very interesting thing happens. You start to grow sprouts. It's called sprouting. And you will grow new nerves to facilitate the release of more neurotransmitters to make this fire quicker and faster. That's why if you do anything a lot, you get better at it, right? So if you type, you type, and pretty soon you're typing and you're just sitting there reading and typing away. You're not even thinking about where your fingers are going. Or if you play piano, or you play guitar, or you drive your car. Do you have to really think so much about driving your car? You should, but but really you just get in it and you just go, and you do it for a few years and you're just not even, that's the problem sometimes. But that's all because of neuroplasticity. Now, let's apply this to fibromyalgia. Let's say now that this nerve, instead of fine motor control of the hand, that this is a pain nerve. Its purpose is to release pain chemicals. The more you feel pain, the better you become at feeling pain. Whoa! Is that something? Because of neuroplasticity, you see your physiology doesn't know the difference. Whatever you do, you get better at it. So the more you feel pain, the better you get at feeling pain. This is why, in those of you who have fibromyalgia, you may have found that you get to the point where almost anything hurts. I put my clothes on, it hurts. Someone pulls in front of me and I hurt, I miss an hour of sleep and I hurt. I miss a whole night of sleep and I hurt for days, right? I eat something bad that I know is bad for me, but I ate it anyway, and I hurt. My husband hugs me and it hurts. Everything hurts because what happens is the nervous system begins to learn to feel everything in terms of pain. Now that's the bad news. You want the good news? The good news is this. There's another saying, and that is, if you don't use it, you lose it. Go back to the piano playing. Did anybody ever learn to play piano and then stop? And did you ever decide to try to go back to it later? And you realize, gosh, I've forgotten so much. You may kind of know it in your head, but your fingers won't do it anymore. And then you kind of, you start doing it, you get better at it. That's because when you stop doing it, what happens is, just like if you put your arm in a cast for 6 weeks, because you broke your arm, you atrophy the muscles. Well, in the same way, this nerve sprouting will atrophy if you don't fire those neurons as much. The less you use it, the less good you'll become at doing it. This is where chiropractic care comes in. Because while we're treating you Ayurvedically, we're getting rid of the toxins, the real offensive material that is causing the hyperimmune response in the body and creating all the inflammation that's causing you to feel such pain and such fatigue because of the immune response. But with chiropractic care now added to this program, we begin to teach your system not to feel pain. And I'm going to show you how that works. If you have, now my artistry is not that great, but let's say this is a vertebra. And in the vertebra there are joints. If you ever look at it on an x-ray, it looks like a little happy face almost. And in these joints are nerve fibers that go into the spinal cord. Now, how many are there? Well, there's a lot. Just for position alone, just to tell you where you are in space so you don't fall over on your face, there are 250,000 proprioreceptors in each joint. They're called proprioreceptors. And the proprioreceptors is that part of the nervous system that tells us where we are. It's estimated that 80% of the energy output of the brain is dedicated towards proprioreception because we live in a gravity world and we have to stand up and not fall on our face in order to live. So the brain puts out a lot of energy just for that. So that's why there's so many proprioreceptors around. Now the interesting thing is that when you stimulate a proprioreceptor, that information goes back to the spinal cord. Near that area. And then it binds what? With another nerve, right? A nerve synapse. And this goes up to the next area called the cerebellum. The cerebellum is that part of the brain that's used a lot for position. All the proprioception comes into the cerebellum. If you have a lesion in the cerebellum, then you're ataxic. You can't stand up. You may fall over. The cerebellum is an important part for balance and control that way. That information goes to the cerebellum. From the cerebellum, it goes to the thalamus. Thalamus is the area of the body that senses pain. Now, isn't this interesting? We have a connection here between position of the body and pain. So from the cerebellum, it binds with the pain center of the body. So you have this little thing going up, and then another one. And then from there, it goes to the hypothalamus, the main controlling area of the brain. From the hypothalamus, another neural connection is made over to something called the para-aqueductal gray, which is a part of the brain that has amazing pain reduction ability. They did a study on cancer patients who were terminal. These people were going out. And so they agreed to be involved in a study where they put an electrode into the PAG part of the brain. Of course, you couldn't really do this if you wanted to live very long, because they had to open up the head to do it. But they actually stimulated electricity into this aspect of the brain, and all of their pain went away. Stopped it. Boom. They did it as a last-ditch effort to get these people out of pain. It has incredible strength in terms of pain inhibition. Well, guess where it goes? Back through some other neurons, it goes right back to this area of the spine where it came from. That nerve signal goes all the way to the brain and back, and it causes two things. It causes pain inhibition, number one, and number two, It causes relaxation of the muscles.